in my opinion, the first thing that people look at is your face, and the teeth and the hair is what people look at. So it's a very important feature in your body, and I'm sure it will boost confidence for a lot of people. My concern is here, and also here, and here. Obviously, I'm losing hair here, so here and here.
Okay.
Then it's standard for men,
Pretty much everything you need.
Yeah.
From here till back.
Yeah.
So in the male pattern baldness, we see the hairline irregularity first. You are losing the hairs from the hairline, or the hairs become thinner in the hairline. Then it is receding inside. And that receding inside is sometimes merging, and it already happened with you as well. And in the same time, we see the crown area baldness too. But more important thing, if the hair loss goes further, this area is becoming low.
Yes,
So maybe you have seen so many people with just hairs here.
Yes.
So that's the natural progress. So that those medications, finasteride and minoxidil, is preventing that thing. And we should prevent that thing. Otherwise, if it goes more, whatever we do here will be just staying there, and you will have a gap there. The hairline, if we start from here, and if we just continue in a similar line, not the same line, maybe we can take a little bit higher, because we need to cover a large area. And the important thing is, if we have enough graft to cover everything.
Do you?
That's a big question of today. That's the most important.
How do you figure that out? When you shave my head, or?
No. I know right now that you need definitely a second session, actually.
Or I have to take from my chest.
That's another issue as well. So,
Habibi.
So from here till here, you need a large number. And you have a donor area here, but of course your donor area is not very sufficient to cover everything. Maybe we can get maybe 4,500 or something with these.
4,500, okay.
But you need at least 8,000.
Okay. Do you want to get from my chest today?
We can get from chest, we can get from the beard as well. So that will be making the number a little higher than it is.
Okay.
So we can cover more. We wanted to smallen, narrow, so we can do more density. We shouldn't enlarge in the area. If we lower the line, it's a larger area.
Like let's say I want the hairline like this.
For
example.
It could be done.
But it doesn't look natural.
No, it will look even natural, even lower. But I think that is okay for your proportions, because we follow some guides for the proportions of the face. For example, in the white Caucasian men, we always wanted to see the golden ratio from chin to nose tip to glabella to the hairline. That should be equal, so that looks perfectly aesthetic. So let's check yours.
So here I have some hair, like here under the hair, under the line.
Yes.
It's okay.
It's okay. I mean, I didn't want to when we do the incisions, we will already doing some hairs like that too, because that gives the naturalness of the hair. So this is your chin to nose tip, nearly 8 centimeter. That is. Usually it is white Caucasian 7.5. 7 here. And this should be between 7 to 8.5. 6, even lower. So you have a very low hairline actually. For example, if you didn't have any hair and if you just come here for a restoration, probably I was going to start 7 or 8 centimeters.
I understand.
But because you have already hair, that's your creation.
Okay.
That's the reason we start from the same point.
Okay.
But we didn't want to lower too
So
much.
here is longer than here, for example. That's what you're saying.
Here's your longest, and here's
a little bit
middle,
yeah.
and here's,
I
for example, usually it is 7, 7, 7. That's the Da Vinci's aesthetical golden ratio rule.
I understand.
With many men.
Because I went with the reviews, and the reviews are right. It's correct. Everything went smooth, and
You are here.
and I'm here, and I highly recommend it, to be honest. And to anyone watching, seriously, the reviews are correct.
Thank you so much.
Excellent service, and I can't wait to eat my chicken.
Looks very good.
but could just stay a little straighter. Okay. Yeah, the line looks good. By the way, we check if the line is even or asymmetric. Circulation problems, infection problems, or sometimes the dislodged graft because of the patient sleeping on, or sometimes they traumatize the tissue and they dislodge the graft. So we are checking those kind of things. If they are not, it's okay for us. I will be checking that too. I'm waiting for my magnifier.
I found a lot of companies, but I think Smile had so far the best reviews and the best feedback. I'll be honest, it's correct. Everything I saw online was true and the service was excellent. So like I said, my father had a hair transplant as well, similar to mine, but they only took from the side and back of the head, not from the beard like they did from me. And he wasn't too familiar with the process, and he didn't know what he went through was good until he saw what I went through. And when he saw what I went through here with Smile, he was surprised. You know, it was very professional, very clean. Everyone was very friendly, especially how the doctor, Dr. Erdogan was working on me. Just a completely different experience, from picking us up from the airport, dropping us off at the hotel, picking us up, dropping us off at the hotel again, from clinic to hotel. Everything was so smooth. So it was a different experience for him as well, especially that he's done it at a different clinic in Turkey. It was something that I wanted to do, and I'll be honest, a lot of people said I didn't need it. I didn't need the hair transplant because I have good hair, quote unquote, but I didn't feel comfortable, and I felt like I did need it. And to be honest, I did need it. I think they were telling me don't do it just so I can wait, but I'm 30 years old and I want to enjoy my hair. And I think now it's better to do it earlier than later, especially at my age. 30 is not that young and not that old. So yeah, I felt like now was a good time for me to do it. And I had a lot of good feedback from friends and family. So advice for people that want to do a hair transplant: you might be very nervous in the beginning, obviously, but really it's everything after the anesthesia is very pain-free. It gets a little bit of tiresome, but it's worth it at the end of the day. I'll be honest. Just take care of your hair and take care of the transplanted areas, and I think you'll be fine. But it is worth it for sure, especially because, in my opinion, the first thing that people look at is your face, and the teeth and the hair is what people look at. So it's a very important feature in your body, and I'm sure it will boost confidence for a lot of people. Follow the true transformation.